Gentleman about a year ago came in that was having chronic back pain and also had anemia and had a pretty thorough workup. Was seen by gastroenterology, had quite a few tests, and we saw him in the office, and he definitely had some upper abdominal pain. He's found to have gallstones, so we went ahead and took his gallbladder out, and it didn't really explain the anemia, but he had a thorough GI workup where they looked in with the camera, studied his stomach, his colon, his small intestine, really didn't see anything. So we took his gallbladder out, thinking that was the etiology of his upper abdominal pain radiating to his back. Took that out, it really didn't improve things. We continued to work him up and eventually had him redo the small bowel, the studies, and found that he had a small bowel mass. Took him in and did a robotic small bowel resection on him. Did it basically through 3 little incisions and then 1 bigger incision where we took the small bowel out of there, put everything back together, and it took care of his pain. I mean, that was clearly the cause of his pain. Can't explain how it wasn't seen on the first round of studies that he had, but it took care of his pain. Eventually took care of his anemia. He was much happier when he came back in because he had been struggling with this for about a year until we figured this out.